The America's Democrats podcast, a project of 21st Century Democrats, is made possible by contributions from our listeners. Want to do more? Go to americasdemocrats.org and click Donate. And thank you for allowing us to be your voice. And if you enjoy the show, please share it with your friends on Facebook and Twitter, and leave us a review on your favorite podcast app. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. I'm your host, Jim Cuddy. This week, why nurses are fighting for single-payer health care and why the American labor movement is mobilizing with them. Plus, Bill Press talks with Politico healthcare reporter Adam Cancryn about what it will take to end the pandemic crisis and what stands in the way. Had enough of Fox News, the House Freedom Caucus, and Donald Trump? If you want the facts that you won't get from them or from the fake news sites of the alt-right, then stay tuned. Our sponsor, 21st Century Democrats, works hard to get everyday Democrats involved in returning our party to its roots and to success at the ballot box. Sit back and listen, then stand up and fight. And follow 21st Century Democrats on Facebook for all the latest progressive news. We're glad you can join us. Whether it's at the bedside or in the offices of our elected officials, nurses are fighting for our lives. And now, in the middle of a pandemic, they're risking their own lives to do so. In this encore interview, Malinda Markowitz explains why Medicare for All is such a personal issue for nurses and why they're campaigning to insure all Americans. And we say hello to Malinda Markowitz, co-president of the California Nurses Association and a member of National Nurses United. She's a retired registered nurse with 40 years under her belt and was most recently at Good Samaritan Hospital in San Jose, California. Malinda Markowitz, thank you for joining us today on the America's Democrats podcast.
Oh, thank you for having me.
Well,
My pleasure.
Certainly our pleasure, too, to have you with us. Medicare for All, there's our topic of conversation today. Why is Nurses United taking such a strong stand on the issue?
Well, as nurses, we see the effects of our broken healthcare system. It's too expensive, it is not sustainable, and it is not giving the patients the care that they need.
Well, what are some of the things that you see every day as a nurse that would compel you to fight the fight?
Oh, there's many. One of the things that we're seeing more of is patients coming in with a stroke or a heart attack because their blood pressure is out of control. Most of the time, you'll see that they can't afford their medications, or they'll take it, they don't take it at all, or they take it every other day. And the doctor orders a specific amount of medication, and often they just can't do it because they're deciding whether to take their medicine or to buy food or to go get gas to go to work. And sometimes because of the horrible cost of health care today, it's deciding that, they have to do these other things, and it's so wrong. And these things are really preventable. We also see patients that come into the hospital, they have diabetes, and they come in very ill. Their blood sugars are high, they have fevers, because when we do our assessment, we notice that they have a huge sore on their legs. And often we see that they have to have him amputated because, again, they can't afford the insulin, which is extremely high. They can't afford the equipment that they need. And, again, this is totally avoidable.
And you even hear about people heading to Mexico or heading to Canada to get the medicines that they do need and that are much more affordable.
Yeah, that is very true. And they sometimes go and have surgical procedures and then come back to the United States with major complications. So Medicare for All is so much needed.
Mm-hmm. Well, Nurses United, as I mentioned, supporting Medicare for All, the Medicare for All Act of 2019, which was introduced by Representative Pramila Jayapal of Washington. What are the important advantages of this legislation?
Oh, there's so many. You know, it's a gold standard and is actually a comprehensive health care. It goes from primary care, hospital, outpatient services, dental, vision, women's reproductive, long-term services, prescription drugs, health care. And it's really based on the needs of the patient, and it guarantees quality of care, not providing less care or rationing. It gets rid of premiums. You have no deductibles, no copays, no out-of-pocket expenses, and you really have the freedom to choose your own doctor, your own hospital, specialty care. No one will be the gatekeeper. You can go and see anyone that you want.
Your California chapter is campaigning in support of SB 562. Tell us about that bill and how the campaign is doing.
Well, we're still pushing for a Medicare for all in California. Like anything, you have obstacles, but we are still 100% committed to a Medicare for all in California. But now we are, focusing at this point, since we have the federal bill that we're going all forward on this. The other thing is we have 30 million Americans that are underinsured, we have 30 million Americans that are uninsured and at least 40 million more that can't afford the cost of the premiums, the copays and the deductibles. And this is why this is the most ridiculous and sad thing about our healthcare system, is why we're seeing more GoFundMe accounts to raise money for their bills. And also we're seeing people filing bankruptcy because of the medical cost. And the life expectancy in the United States is lower than any other nation, and while also our infant mortality rate is much higher than other nations. And this is sinful. This is, we have to change our system.
Yeah, and we should point out that of the industrialized nations, there are plenty of them that they're not, there's tyrannic socialist regimes that, or what, we're talking about Canada. We're talking about places all over Europe where it's national health care and everyone's taken care of and everyone gets everything that they need.
Right. And it's really a shame that we can't have that for our American people in the United States. And actually we could, but, there has to be the will of our elected officials. And right now, 70% of our Americans want Medicare for all. And I think that they need to listen to us, and we're making sure that they do.
We're speaking with Malinda Markowitz, who is co-president of the California Nurses Association and member of National Nurses United. She's a retired registered nurse with 40 years under her belt. And Malinda, there is the critique of single payer that it is that transitioning to single payer is too dramatic, it's too complicated and unwieldy. As someone who works in healthcare and has seen all the things that you've seen in your 40 years, how do you respond to that?
Oh, well, nurses have been on the front lines for decades, and this is really deeply personal for all registered nurses in the United States. We see firsthand the struggles our patients go through trying to afford their health care, and people are literally sick and dying from our current broken system. And so Medicare for All would simplify the healthcare system. It will reduce the hundreds of billions of dollars wasted on administrative cost because of our current ineffective multi-payer system. This legislation prevents providers from using payments from this program to benefit their profits and marketing. And the most important thing, I think, or one of many important things, is we would save $2 trillion over 10 years. And the other thing is Medicare now is working for the seniors. So this is going to just be expanding it, but improving on Medicare.
Now, of course, there are opponents that see Medicare for All as an extreme left-wing proposal. How do you see it?
Oh, well, that's absolutely not true. And I think it's, just people that, for whatever reason, don't want people to really have health care. But this is supported by both parties. And like I had said earlier, 70% of Americans want the Medicare for All. And this is really about saving lives and having health care be a right, not a privilege.
Amen to that. Malinda Markowitz, co-president of California Nurses Association, member of National Nurses United, joining us today on the America's Democrats podcast to talk about Medicare for All and where it's going on the national level as well as at the state level in California. Malinda, thank you so much for your time with us today. Wishing you the best of luck, and hopefully we can hear back from you again soon.
Oh, I would be my pleasure, and thank you again so much.
You're quite welcome. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen to this americasdemocrats.org podcast, a project of 21st Century Democrats. But we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to americasdemocrats.org and click on Donate at the top of the page.
This Social Security measure, I believe that we must pass legislation to provide medical care.
This is our tradition. When our grandparents came to America, it was the Democratic Party which said, welcome. It was the Democratic Party, the party of Roosevelt and Truman and Kennedy and others, who said that America belonged to all its people, not just a handful of the rich or a few giant corporations. That's why great leaders like FDR fought so hard for Social Security, and why JFK stood up to the insurance companies and their Republican allies to get Medicare. It's not just one thing, or one time, in one place. It's about a whole history of standing up to the Republicans and saying someone has to be on the side of regular working people in America, whether it's defending Social Security or just the way your loved ones are treated on the job. That's what the Democratic Party is all about. And that's why this message has been brought to you by the Democratic Party. Working people like you and me.
Paid for by 21st Century Democrats. Not authorized by any candidate or candidates committee. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Coming up next, how America's unions are fighting for single-payer health care. But first, we turn to Jim Hightower, America's #1 populist, for his common sense commentary.
One thing we've learned for sure this year is that no national crisis is too awful to keep Trump and company from exploiting it for their plutocratic political purposes. COVID-19 is a god-awful crisis, but late one night deep inside the White House, a dim bulb flickered in our present president's head. "Eureka!" Trump exclaimed. "Here's our chance to kill the U.S. Post Office." Of all things a president might focus on during a devastating pandemic, hijacking your and my public mail service, bankrupting it, and then privatizing its profitable functions has become a top priority for this brooding madman. Bizarrely, Trump has ranted that the post office should charge higher prices for us customers to ship packages, and he bemoans the fact that postal workers are unionized and earn middle-class wages. So, in February, with our economy collapsing under the weight of COVID-19, Trump struck. Like nearly every business, the Postal Service had suffered a crushing loss of customers and needs emergency funding to keep America's mail moving. Congress quickly proposed a bipartisan $13 billion postal lifeline, but our personally piqued president said no, threatening to kill the whole national rescue package if it included a pandemic grant to save the post office. The U.S. Mail Service, however, is enormously popular, so Trump can't just blatantly choke off its survival funds. Instead, he's taking the agency hostage, offering to provide a $10 billion loan from the Treasury Department, contingent on the public entity agreeing to his draconian demands that it raise postal prices, gut postal unions, and cut postal services. This is Jim Hightower saying Trump's provisos are postal poison pills, for they would undermine popular support and clear the political path for profiteering corporations to seize, privatize, and plunder this public treasure.
Need an antidote to the progressive blues? Want some good news about how grassroots folks are rebelling against the corporate powers and winning? Well, here's an easy-to-swallow pill for you, the Hightower Lowdown. Hightower's monthly newsletter will give you the lowdown, even as it lifts you up. It's 4 pages a month, jam-packed with facts you can use, actions you can take, and Jim's own Texas humor, all for only $15 a year. To become a lowdowner, go to hightowerlowdown.org.
This is the America's Democrats Podcast, the weekly podcast for stand-up Democrats. The coronavirus pandemic means millions of Americans are losing their jobs and their health insurance. The Labor Campaign for Single-Payer Health Care believes that health care is a fundamental human right. In this encore interview, National Coordinator Mark Dudzik says it's up to unions to take the lead and fix our broken health care system. And we say hello to Mark Dudzik, a National Coordinator of the Labor Campaign for Single-Payer Health Care. Mark Dudzik, thanks so much for joining us today on the America's Democrats Podcast.
Well, it's great to be here.
Now, it may come as a surprise that there are some members in the labor movement that oppose a single-payer health care system, such as Medicare for all. What's the history here?
Yeah, well, I think there's 2 things that have happened. The first is that because of sort of a unique failure in the 1940s to continue the New Deal, the American labor movement took to negotiating healthcare benefits and linking healthcare to employment, and was fairly successful in that for a number of years. And it was a real source of pride for unions that they were able to provide decent healthcare benefits for their members. And they talked about it as a real union advantage, and a sort of a culture grew up that celebrated and supported that kind of work within the labor movement. Now, that started to fray about a quarter century ago, to be honest, as the costs of healthcare became more and more unsustainable, and as employers started going head-on after that. So what became a union advantage often now had become a real struggle and a difficult component of union bargaining, so that healthcare for the last couple of decades has been the biggest cause of strikes and lockouts and concession bargaining. So that has kind of moved. But the other dynamic I think that's happened is that often the labor movement, because it's a multi-issue organization, really doesn't want to get too far off message from the Democratic establishment. And so, when we had the Democratic presidential candidate in the last cycle telling people that we would never, ever have single payer, a lot of unions listened to that and felt that they should not really be seen as criticizing the candidate that they endorsed. So I think the dynamic has changed since that moment. Almost every candidate who is conceivably running for president has said that they support some kind of a version of Medicare for all, and that's opened up great new opportunities within the labor movement.
Mm-hmm. Let's talk about private insurance. How is the private insurance industry, how is it failing American workers?
Well, let me count the ways. I mean, the private insurance industry, they have a flawed business model to begin with. They make money by denying people care. And, when you have that kind of situation that treats healthcare as a profit center rather than as a public good, you have all the kind of distortions that kind of profit-taking produces. So, we have the most expensive healthcare system in the world by almost 100% more than the average for advanced industrial country. And we, studies have shown that a working class family of 4 that has decent employment coverage, that the total costs for that family exceed $28,000 per year. And employers pick up an average of $15,000, and the worker and their families kick in the other $13,000 or $14,000. And you can just see that becomes unsustainable. The amount that workers have paid for health care, the percentage that they've paid as opposed to the employer, has gone up every year since they started keeping track of this in 1984. So the private insurance industry is just shoveling more and more pain and liability onto the backs of most working families.
Mm-hmm. Now, unions, Mark, are often in the position of bargaining for better health care for their members, of course. What's the impact of that on a sense of solidarity with unions?
Yeah, well, that's really the point of contact that a lot of people have with the issue of health care justice is, when they're in that bargaining cycle and they're facing the demands that almost every employer brings to the table nowadays to cut benefits and narrow networks and increase copays and deductibles and co-insurance. That's an opportunity to both engage with our members on this and to engage with the wider working class movements that are struggling for healthcare justice. So, the smart unions will frame those fights as fights for healthcare for all and use it both to educate their members on the ground and also to reach out into the community and say that we're fighting not only for the healthcare benefits that we fought so long to win, but we're fighting to expand healthcare to everybody, regardless of their employment status and their union membership.
We're speaking with Mark Dudzik. He's National Coordinator of the Labor Campaign for Single-Payer Health Care. Mark, let's talk more about your organization, the Labor Campaign for Single-Payer Health Care, and what you hope to achieve.
Yeah, so we launched this project in January of 2009, which was right before the first inauguration of President Obama. It was a very different time, a very hopeful time in a lot of ways. And we launched it because we knew that the political debate was going to be wide open around where to go on healthcare policy, what the future of healthcare was. And we wanted to sort of weigh in, make sure that there was a voice that demanded that single payer be put on the table in those debates and discussions. And so we started with a small group of national unions and a couple of dozen local and regional union organizations around the country who were really committed to pushing this and pushing the labor movement to take the lead in this fight. And, over the years, we've been able to build this out. There's now 14 national unions who are affiliated with our project, a couple hundred regional unions, local unions around the country, including some statewide labor federations. And, the AFL-CIO has taken positions in support of the goal of single-payer Medicare for all at the last two conventions. So we've really become a real powerful pole within the labor movement that says that we have to organize and commit resources and political muscle to this fight for healthcare justice.
And, if the labor movement fully backed single-payer health care, what kind of difference could that make in the debate?
That would be a game changer. If the labor movement put the kind of resources into this fight that they can still put in, even in our weakened state, that they can still put in into existential fights, we would be, much further along on this fight. If they, made this one of their top 2 or 3 issues for lobbying, if they educated and mobilized their members, as some unions are doing today, if they use their political relationships locally and nationally, we could really begin to move this much more aggressively in the body politic.
It seems like it would be, obviously it's, numbers, big numbers. The more people you have, the more success you have. So is there a sense of, perhaps from your organization, of creating sort of a snowball effect and getting more and more of labor movement to fully back the single-payer healthcare?
Yeah, I think we're right at that moment. We see it, it's entering the general political dialogue. Union members now, hear and discuss and think about these things much more than they did 10 years ago when we launched this project. So, in many ways, we've won the battle of ideas. So now it's really the question of, implementing a real effective strategy that mobilizes us at the grassroots and can move this campaign forward. So we've really, we're really at a crucial moment, and not just within labor. This sort of reflects a much broader social movement that's emerged that sees Medicare for all as sort of the wedge issue of a broader transformational politics that people are beginning to embrace. It's a real funny time politically right now. You know, we have these huge challenges with this out of control Trump administration that's trying to push us back into the 19th century. But on the other hand, you know, on the ground, we have all of this ferment of people, you know, working towards a much better world, and a world that treats things like healthcare as a public good and not a commodity. And I'm actually very hopeful that we can move forward in these times.
Well, and you're working with a lot of organizations. Who are some of your allies in this fight?
Okay, well, within the labor movement, I have to say that organizations, unions that represent nurses are the leading lights in our movement. Nurses really get this issue. They're passionate about the desire to create a system that serves the needs of their patients, and they see all of the flaws in the current system. So the National Nurses United, which is the largest national nurses union, is head and shoulders above any other labor organization in this fight, and a number of other nurses unions, like the New York State Nurses Association, and the AFT nurses in Vermont. A number of other nurses unions are really active in this fight. So that's really, and they help transform labor with us. And then there's other organizations on the ground. Healthcare Now is an organization that's been doing community-based organizing and agitating for a number of years, and we really consider them to be our sister organization. Some of the newer progressive organizations have been really consistent on taking this issue up. The Progressive Democrats of America have been with us from the date that they were launched, as has Our Revolution, and some of the longer-term social movement organizations like People's Action and Campaign for Popular Democracy and Public Citizen have also begun to move this into the center of their political and organizing agendas. So we're building some real momentum and building a broad coalition of social movement and labor organizations.
Well, let's keep that snowball growing. That's all I've got to say. Mark Dudzik, National Coordinator of the Labor Campaign for Single-Payer Healthcare, joining us today on the America's Democrats podcast. Mark, thank you so much for your time with us, and we do look forward to having you back again with us soon.
Great. Love to be back.
Thank you very much. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen, but we need you to stand up and fight. Help get our party back to its roots and to success at the ballot box. Make your contribution to keep the americasdemocrats.org podcast, a project of 21st Century Democrats, on the air, and help elect stand-up Democrats. Go to americasdemocrats.org and click on Donate at the top of the page. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. The right and wrong way to reopen the nation. Bill Press talks with Politico healthcare reporter Adam Cancryn.
Every day, we see in some areas some signs of improvement with the coronavirus, but also every day on the macro level, the number of cases and the number of deaths keeps growing. So let's start out. Can you just give us some idea of exactly where we are with the status quo? Have we peaked and have started the downhill curve, or are we still climbing uphill?
Absolutely. So by all accounts, and we are about 2.5 to almost 3 months into this epidemic that quickly became a pandemic. We are, by all accounts, past the peak that we can tell right now. So the good news here is that we've reached a point where we no longer have to worry at this point about health systems being overrun, about hospitals for now not having enough hospital beds, things like ventilators, to take care of the surge of patients. That being said, we still have a long way to go. The downslope is very far down. Last I checked, we're at about 965,000 confirmed cases. And in the next couple of days, we're almost sure to top 1 million. And we have had more than 54,000 Americans die since February. So that in just a couple of months is more than the entire U.S. death toll of the Vietnam War. So that's where we're at. I mean, the good news is we are likely past the peak. The bad news is that this is still just a rolling, massive public health crisis that will probably be with us for the next several months. The next thing we really have to worry about is a resurgence of outbreaks as some states start to try to reopen. And in the fall, when flu season kind of comes back, and we have to worry about a resurgence there as well.
I want to get into both of those areas with you, but you alluded to this. It was just a couple of weeks ago that there were many stories about hospitals not having enough beds. They're setting up beds at the Javits Center in New York, in Central Park in New York. The worry about ventilators and the rush to get as many ventilators, that the hospitals would run out of room and they would run out of equipment. That didn't happen, right? Why?
It didn't. And what's been interesting to see is there's been a kind of rolling set of crises, right? So if you remember early on, the big concern was, do we just have the sheer amount of hospital beds to house, this wave of patients? And in response, the hospitals responded by essentially clearing their facilities out, right? So you had hospitals that in some cases were just sitting empty, waiting for this crush of new patients, right? So that was how we dealt with the first issue. The second crisis was sheer number of ventilators, right? And so for a few weeks, that was the big worry. We weren't going to have enough. The federal government took some steps to kind of try and free up ventilators. There was this kind of massive shifting of sending ventilators around the country and producing new ones. And we think that now that we're past the peak, there's not as much of a concern of that. One of the things that's persisted throughout the entire pandemic so far is this concern about protective equipment, about PPE.
Yes.
And the problem here is that PPE is just needed constantly. Any kind of procedure you do, any patient you see, you have to put the gloves on, you have to put the mask on. You're not supposed to use it more than once. So we are already doing things like wearing masks for multiple patients that are not recommended under normal circumstances. It's going to continue to be an issue because as hospitals, start clearing these coronavirus patients out and start taking more elective patients back in, there's still going to be that kind of demand. So it's been interesting because we've seen this kind of rolling supply and demand. The last we're hearing of right now is, more basic things, hospital gowns, that kind of stuff that will continue to be an issue.
Right.
And then I guess the last thing I'll mention, and we can get into this much more, is obviously testing and the constant need for more tests.
That's exactly where I was going next. Doesn't it all depend on, I guess, how can we know where we are if we don't know who's got it and who doesn't? And we can't know that without testing, right?
And that's been the difficulty this entire time, is if you're not testing and if you're not testing in a sufficient amount, sufficient frequency, you don't know how the virus is spreading, where it's spreading. What's really needed is an ability to kind of surveil the virus, for lack of a better word, to know how it's moving and how it's changing and who it's affecting. And right now, testing has ramped up significantly, but it's nowhere near what's needed. Now, I'll give you an example. Right now, we're at about 5.5 million tests that have been run, which is great. It's been a great ramp up. Actually, in the last couple of weeks, we've seen about 2 million more tests come online. So significant improvement there. But the recommendation is at the lowest point, we'll need about 3 million tests just per week to kind of be able to feel like we have a good sense of how this virus is behaving and where it's spreading. So you can see the kind of gap there. And that's frankly just going to take time. It takes time to produce these tests. It takes time to produce the materials that are related to them, the swabs and the reagents and the things you need to run them, and to get them to the different areas where they're in highest demand. So that continues to be a really persistent problem and the thing that's holding us back at this point.
Yeah, well, what is the drag? I mean, what is holding it back? Just did we get too late of a start, or are they not producing enough tests, or?
There are a couple of reasons, and I'd say it's still a little bit of a mystery what exactly is the holdup, but there are a couple that I can kind of run through. One, we did get a late start. So if you go back to the early days of this crisis, the CDC was developing a test. They thought they had developed one that they could distribute to the public labs all around the country. It turned out that the vast majority of those tests did not work. And so we lost these 2 or 3 weeks where preliminary testing could have gone on. Instead, you just had the virus spreading and us completely blind almost to what was happening. So those weeks are weeks that set us back that we are just not going to be able to catch up to, right? So you're already behind the 8 ball. The second issue is, again, just sheer manufacturing. We're not supplied and we're not ready for a crisis of this scale. And so ramping up production takes time. And there has been a reluctance from the president, from the federal government, to use the Defense Production Act, which essentially gives the government the ability to go in, say to a manufacturer, you're effectively working for us now. We need you to produce these tests and give them to us as fast as possible. So there's been a reluctance to use that power. And as a result, it's been a slower ramp up of tests and test materials. It's not at this point exactly clear what needs to happen next or what can happen next in order to get us from 5.5 million tests overall to 3 million a week. Some that I talk to say we just need the actual physical tests. Others say there's issues with the materials and getting them. You can talk to other groups where they say it's just a matter of capacity, of having the space, of having the ability to have people drive to a university parking lot or to a stadium and be physically there to get the tests. So logistically, supply chain wise, it's a lot of just details in there that need to be worked out.
I want to ask you about the antibody tests later, but just speaking about these tests as to whether people have the virus or not, are there some tests that are better than others? Are they all equally good? We know about the nose swab. We know about the finger prick. Are they all reliable?
That's, I think, something that is still being studied. So the assumption is that the vast majority of these are reliable. The difficulty is when you're trying to get these tests out as fast as possible, they're not going to go through all the stress testing that you normally would, right? So there's always a possibility that, tests go out and they're not as accurate as you would like. And therefore, now you're having to run multiple tests on people. Now you're kind of questioning the results. So overall, you're right. There are multiple different types of tests. They all do, try to accomplish the same job, but through different ways. Some are swabs, some are these kind of rapid 15-minute tests. The difficulty, though, is you have to balance speed versus quality, right? And getting a lot of these out while also being reasonably confident that the ones that you're sending out are going to be giving you the right results.
So without wider testing, do we really know how many cases there are? I mean, I keep seeing these stories that perhaps the number is a lot higher because people might have had it and didn't know? Or?
It's likely much higher. So I said we had about 54,000 who have died since February. Then that number is likely significantly higher by the thousands, tens of thousands, solely because you're only counting people who have come into a hospital, for example, who have died or who have had a confirmed case there. There are people that obviously we're missing, people who die in their homes, people who die from complications of coronavirus, but also other symptoms. So we're just not getting a full picture. And this is the case with, pretty much any disease, especially any kind of large scale crisis like this. But especially now where hospitals, where providers are just trying to kind of triage and stay above water, you're not getting to the patient accuracy that ideally we would like.
And now the challenge facing every one of the 50 states is to reopen or not to reopen. And we've seen that already. Georgia, particularly South Carolina, Tennessee, a couple of other states have eased the restrictions somewhat, at least, to allow businesses to open. Are they doing the right thing, or is it too early?
Well, time will tell, and it depends on who you ask about that. If you talk to epidemiologists, public health community, I think the overall feeling is that it is too early, and for the reasons that we've talked about. There's not enough testing in states like Georgia. There's not even convincing evidence that they are past the peak of cases yet, And so what you're doing, if your goal is to kind of suppress this overall case count, what you're doing now is introducing new variables where you could kind of fuel a resurgence or a new outbreak. So in Georgia, for example, if you feel like you've now just kind of started to get control of this virus, you've kind of assured that your facilities will not be overrun. Now you're opening up businesses again. You're putting people back in groups and tight clusters, and you're just essentially allowing the conditions that the virus needs to start spreading again. So it's an experiment. I mean, if you ask the public health community, like public health experts, they're going to say it's too soon. Then again, there are governors who are looking at the economic toll that this is taking on their states, being shut down for 5, 6, or 7 weeks, and saying this is not something that we can kind of go on doing. So it's a little bit of a balance. The early states are going to tell us enough. In the next couple of weeks, we should be able to see what the impact is of these early states like Georgia, like Colorado, starting to kind of reopen a little bit.
What are health professionals looking for to gauge whether or not it's okay to at least start to gradually open up? What do they want to see?
They want to see a few things. One, and ideally, you would have the kind of testing capacity to be able to, rapidly test people and do it frequently. And honestly, almost countrywide, that's just not going to be the case as of now or in the next couple of weeks. Some other things, you want to have a reasonable confidence that you are past the peak of your cases, right? Because the worst thing and the baseline that you do not want to risk is an outbreak that overruns your hospitals, your health system. So you have to have reasonable confidence that the virus and the cases are on the downslope rather than still going on the upslope. And beyond that, you want to have just kind of reasonable guidelines for this reopening. Nobody's saying, and I think nobody wants to just kind of like a light switch, just flick things back on. That I think the consensus would be a disaster. What you want to do and what the recommendations are is to do something that's very, very gradual. So if there is a resurgence, if there are bad indications a couple of weeks from now, you can kind of quickly put people back under lockdown, say, we need to roll this back and get back control of the virus and of how it's spreading.
So what's that going to look like when you say gradual? It doesn't mean a stadium full of 30,000 people to see a Nats game, for example, right?
Yeah, that may be a while before people feel comfortable doing that.
Right. But does it mean still wearing a mask when you go into any store, for example? I saw one of the states where they said restaurants, I think maybe it was Alaska, restaurants can reopen, but you have to be 10 feet away from anybody else.
Yes.
Is that what we're looking at, those kinds of?
Yeah, I think the idea is things may end up looking like they did early on in this crisis, where there was recommendations to just kind of take steps to try and protect yourself and others, right? So to your point, that includes, wearing masks when you're out in public, wearing gloves when you're going to be, in stores and handling things that other people may have touched. In the case of restaurants, that may mean half capacity, operating at 50% capacity versus 100% to keep as much distance between diners. Same thing with businesses, with grocery stores, limiting the flow of people in and out. And again, you want to be focusing on businesses that, you feel like can open up with some of these restrictions, but that won't, again, put people in clusters, right? So the idea of stadiums opening, the idea of anywhere, clubs, concert halls, that's going to be toward the end, I think, because it's very difficult to put in any kind of restrictions where that would work without putting people close together. So yes, you're likely to see small businesses, restaurants, stores, those kinds of things reopen, but with some pretty strict restrictions.
One very frightening aspect of this is that we have seen that the coronavirus disproportionately affects the minority community, particularly the African American community. Why is that?
Well, it's a number of reasons. It's a good point. I was just looking at the data here in Washington, D.C. where African Americans make up about 44% of the population, and so far almost 80% of the deaths. And that's likely due to a number of things. One, especially in a city that's as segregated as DC, the availability of hospitals, of providers, is just kind of disproportionate, right? So it's more difficult for minorities, people of color, to get to doctors and hospitals, as one example. Secondly, is just a matter of having the knowledge and being able to distribute the information, right? Not everybody is watching the president's press briefings every single day, right? And so it's a matter of figuring out a way to distribute the information that people need, to convince people to stay in their houses, to use gloves and masks, et cetera. And the third is I think just kind of a plain truth everywhere, is disproportionately communities of color are these essential health workers, right? Mm-hmm. So they are the ones who are in grocery stores, they're the ones in convenience stores, who have been working through all of this and working, in a lot of cases for the working poor, because they have to and don't really have the choice that you or I do to be able to kind of stay in our homes. So automatically, the odds for these communities go up significantly. And if you combine that with just the pre-existing health disparities, the higher rates of things like diabetes and respiratory conditions, that is a combination that doesn't fare well in this situation. And that's likely why you're seeing these kinds of disparities and along demographic lines, racial lines.
Bill Press talking with Politico healthcare reporter Adam Cancryn. If you'd like to hear the entire interview, visit BillPressPods.com. That's all for the America's Democrats podcast. Thank you to all who made today's show possible. Malinda Markowitz, Mark Dudzik, and the entire Bill Press team. And thank you for listening. If you liked what you heard, please get involved in our efforts to keep this show going and to elect Democrats who are bringing the party back to its roots. Go to americasdemocrats.org and click on Donate at the top of the page. And be sure to find 21st Century Democrats on Facebook and Twitter, and leave us a review on your favorite podcast app. For the America's Democrats podcast, I'm your host, Jim Cuddy. We want you to sit back and listen, but we need you to stand up and fight. Join us. Support the americasdemocrats.org podcast, a project of 21st Century Democrats, and help elect Democrats who will stand up for democratic principles with your contribution today. Go to americasdemocrats.org and click on Donate at the top of the page.